You wake up in the morning, go to the bathroom to take care of business as usual, and suddenly something catches your eye. The color isn't normal. It's not that brown you've seen your whole life. It's different, strange, almost pale, as if it's lost all its pigment. You flush, trying to forget it, but that image hammers in your head all day. The next day, it happens again. And the day after that, too, you start to feel a tightness in your chest, that knot in your stomach that comes when you sense something is wrong, but don't want to believe it. You think about your bills, the grandkids you still want to see grow up, that trip you promised your spouse. You think about everything except going to the doctor because deep down, you're afraid of what they might say. You remember that a few months ago, the doctor mentioned fatty liver, but you didn't pay much attention. After all, you felt fine. You were working normally, living your life. But now, looking at that toilet bowl, you start to wonder if you shouldn't have taken it more seriously. And what if I told you that this change in stool color could be one of the first visible signs that something very serious is happening with your liver? That this seemingly simple sign could be screaming that you need to act now, before it's too late? Because here's the truth nobody tells you. The truth that I, as a hepatologist with over 20 years of caring for patients with liver disease, see every day in my office. Pale whitish or clay-colored stools aren't just a digestive curiosity. They are a red alert that bile, that yellowish-green fluid produced by your liver, isn't reaching your intestines as it should. And when bile doesn't reach the intestines, it's because something is blocking the way. It could be a gallstone, it could be severe inflammation, or it could be something nobody wants to hear, but that I need to tell you with all honesty, because your life might depend on it. It could be a tumor. It could be liver cancer. Now, before you panic and close this video, I need you to take a deep breath and stay with me until the end, because I'm going to show you exactly what you need to look for. What other signs appear along with this change in stool? What to do immediately if you identify these symptoms? And most importantly, how to differentiate a simple problem from something that truly needs urgent attention. I am Dr. Fernando Mendez, a hepatologist, and for the past 23 years, I've dedicated my career to saving livers and saving lives. I have seen patients who came to my office with symptoms they ignored for months, and I've also seen patients who acted quickly and managed to reverse situations that seemed impossible. The difference between these two groups isn't luck, it's information. It's knowing how to recognize the signals your body is sending. If you've made it this far, it's because you're truly committed to your health, and that makes me very happy. I created this channel precisely for people like you who don't just want to hear a diagnosis and accept it passively, but want to understand what's happening inside their own bodies, want real solutions, want tools to take charge of their own health. Every week I bring you updated information based on the latest medical research, things that many doctors don't know yet or don't have time to explain in detail in their offices. Subscribe to the channel now and turn on the notification bell, because I'll guide you on this journey of protecting your liver. You're not alone in this, and together we'll identify the signs, understand the risks, and act before it's too late. Now let me tell you the story of Mr. Paulo, a 68-year-old patient who came to my office about 2 years ago. Paulo was retired, had a quiet routine, enjoyed gardening, walking with his wife, and seeing his grandkids every weekend. He'd had fatty liver for years, discovered during a routine checkup when he was in his early 50s. But like most people, he didn't pay much attention. The doctor told him to lose a little weight, exercise, avoid fried foods, and he even tried for a few weeks, but then went back to his old habits. Life went on as normal, no symptoms, no pain, nothing to indicate a problem. Until one day, Paulo started noticing his stools were different. At first, he thought it was something he ate, then he thought it might be an intestinal issue. He took some medication on his own, but the color remained strange, almost white, like putty. He didn't tell anyone, not even his wife, because he felt embarrassed, thought it was silly, that it would pass on its own. 3 months went by like this, with Paulo living with that symptom in silence, until other signs started appearing. He noticed his urine was very dark, almost Coca-Cola colored, and that's what scared him. He also started feeling an absurd fatigue, the kind where you wake up already exhausted, as if you'd run a marathon during the night. His belly started to swell, his clothes became tight. And then came the worst of it all. He started turning yellow. First, it was the whites of his eyes, that yellowish discoloration his wife noticed one day during breakfast and said, "Paulo, you look yellow. You need to go to the doctor now." When he finally arrived at my office, I looked at him and knew immediately it was serious. I ordered a battery of tests, ultrasound, CT scan, complete blood work, and what we discovered changed his life forever. Paulo had progressed from simple fatty liver, that harmless fat he'd ignored for years, to severe steatohepatitis, then advanced fibrosis, and finally had developed hepatocellular carcinoma, which is the most common type of liver cancer. But here's the part I need you to understand, and pay close attention to this because it could save your life. Paulo was lucky even though he waited so long to seek help, because we managed to catch the tumor in its early stages. He underwent treatment, had surgery, localized chemotherapy, completely changed his lifestyle, and today, 2 years later, he's in remission, back to tending his garden, back to watching his grandkids grow. But I think every day, and he does too, about what would have happened if he had waited a few more months to seek help. Because the difference between early-stage liver cancer and advanced liver cancer isn't just about treatment, it's about survival. In the early stages, treatment success rates are high. You have options, you have hope. In advanced stages, options drastically decrease, and so does time. Now I need to ask you a question, and I want you to be completely honest with me, because your answer could help thousands of people watching this video right now. Have you noticed any changes in the color of your stool? Is it lighter, whitish, or that clay-like color that seems abnormal? Or perhaps you've ignored this sign, thinking it was nothing serious, that it would just pass on its own. I know how hard it is to look at these signs and admit something might be wrong, because we're scared. We don't want to believe our bodies could be in danger. But I'm here to tell you that recognizing these signs isn't weakness, it's courage. It's the first step to saving your own life. So I want you to comment down below. Use these words if you like. I've noticed changes in my stool, and I'm going to seek help. Don't be ashamed, don't feel judged. This is a safe space. And when you comment, you're showing other people they're not alone, that it's normal to be scared, but it's necessary to act. You're creating a chain of support, of strength, of life. Comment now, because I read every single comment, and your story matters. Your decision to act matters. Let's understand what exactly is happening in your body when stool changes color, because knowledge is power, and the more you understand the mechanism behind the symptoms, the faster you'll recognize when you need to seek help. The liver is an extraordinary organ. It's the largest gland in the human body, weighing around 3 pounds, and it performs over 500 different vital functions. One of these essential functions is the production of bile, that yellowish-green liquid we mentioned earlier. Bile is constantly produced by liver cells called hepatocytes and stored in the gallbladder until it's needed. When you eat, especially when you eat fats, the gallbladder contracts and releases bile into the small intestine through a system of ducts, which are like tiny tubes connecting the liver, gallbladder, and intestine. Bile has several functions, but one of the most important is aiding in the digestion and absorption of fats. And it's also responsible for the characteristic brown color of stool. This happens because bile contains bilirubin, which is a yellowish pigment produced when the body breaks down old red blood cells. This bilirubin travels through the intestine, undergoes transformations by intestinal bacteria, and turns into stercobilin, which is the brown pigment that gives stool its color. Now, when something blocks the flow of bile from the liver to the intestine, whether it's a tumor growing and compressing the bile ducts, a stone obstructing the passage, severe inflammation closing off the channels, or even the destruction of liver tissue by cancer that prevents adequate bile production, the result is always the same. Bile doesn't reach the intestine, bilirubin doesn't reach the stool, and the stool becomes pale, grayish, whitish, with that clay or putty-like color that's alarming when you see it. But here's the crucial detail that distinguishes an experienced doctor from someone who just reads symptoms online. Pale stools on their own can have several causes, some of them benign. You might have eaten a lot of rice, a lot of milk, a lot of potatoes, foods that naturally make stool lighter temporarily. You might have taken too many antacids, especially those containing aluminum hydroxide, which also lightens stool. You might have had an X-ray with a barium contrast recently. These are temporary harmless causes that resolve on their own in a day or two. The difference lies in persistence and the presence of other associated symptoms. If your stool has been pale for more than 3 consecutive days, and you're also noticing very dark urine, like black tea or Coca-Cola, then you have a pattern of bile duct obstruction that requires urgent investigation. If, along with pale stools, you're experiencing intense itching on your skin, especially at night, that itch that doesn't improve with any cream or ointment, that's another sign that bilirubin is accumulating in the body because it's not being eliminated normally. And if, on top of all that, you start noticing a yellowish discoloration in your skin and eyes, which we call jaundice, then you have the classic triad that every doctor immediately recognizes as bile duct obstruction, and which can indicate anything from a gallstone to a malignant tumor in the liver or bile ducts. Let me tell you about Mrs. Margarita, a 72-year-old patient I saw about a year ago. Margarita had a history of fatty liver for over 10 years, diagnosed during a routine ultrasound, but since she never felt anything, never had pain, never had any symptoms, she simply ignored it. She kept eating the way she always did. Sweets every day, fried foods, sodas, without any exercise because she said at her age it wasn't worth trying to change anymore. One day she noticed her stool was very pale, almost white, and at the same time her urine was extremely dark. She mentioned it to a friend who said it must be an intestinal problem and suggested she take a laxative. Margarita took the laxative, and it obviously didn't help at all because the problem wasn't intestinal, it was hepatic. A few days later, she started itching, first on her hands, then her arms, then her whole body, an itch so intense she couldn't sleep at night, scratching herself until she broke the skin. And then she started turning yellow, so yellow that when she finally arrived at the hospital emergency room, the on-call doctor immediately sent her to the hepatology department. The tests revealed that Margarita had developed a cholangiocarcinoma, which is a type of cancer that arises in the bile ducts, often associated with years of chronic liver inflammation caused by untreated fatty liver disease. The tumor was completely obstructing the main bile duct, preventing bile from reaching the intestine, which is why her stool was white and her skin was yellow. Unfortunately, Margie's case was more advanced than Mr. Paul's, and she needed a much more aggressive treatment. She underwent surgery to try and remove the tumor, but it had already spread to nearby lymph nodes, so she also needed systemic chemotherapy, radiation therapy, and a procedure called a biliary stent, which is a small tube placed inside the blocked duct to allow bile to flow again. It was a long, painful, expensive treatment, emotionally devastating for her and the family. And all of this could have been avoided, or at least minimized, if she had taken seriously the diagnosis of fatty liver she received 10 years earlier. Because here's the truth I need you to understand with absolute clarity. Fatty liver disease isn't a death sentence. It's not an inevitable path to cancer, but it is a significant risk factor that increases your chances of developing much more serious conditions if you don't take action. Hepatic steatosis, especially non-alcoholic fatty liver disease, NAFLD, which is the most common nowadays, affecting nearly a third of the global adult population, is a condition where liver cells accumulate excess fat. In the beginning, it causes no symptoms at all. The liver keeps functioning, you feel fine, you live your life normally. But over time, in some people, this fat starts to cause inflammation, and then the condition progresses to what we call non-alcoholic steatohepatitis, or NASH. When you have NASH, the liver isn't just fatty, it's inflamed. The cells are being continuously damaged, and the body tries to repair this damage by forming scar tissue, which is what we call fibrosis. As fibrosis progresses, it can lead to cirrhosis, which is when the liver becomes so scarred that it loses its ability to function properly. And here's the big problem. Cirrhosis is one of the main risk factors for developing liver cancer. People with cirrhosis have a much higher chance of developing hepatocellular carcinoma, which is the most common type of primary liver cancer. But even without reaching cirrhosis, the chronic inflammation caused by NASH already increases the risk of cancer. Why? Because every time a cell is damaged and needs to regenerate, there's a small chance that something goes wrong in that regeneration process, that mutations occur in the cell's DNA, and that these mutations turn a normal cell into a cancerous one. The more inflammation you have, the more time cells need to regenerate, the greater the accumulated risk over the years. It's like playing the lottery. If you buy one ticket a month, your chances of winning are low. But if you buy 1,000 tickets a month for 20 years, eventually your odds increase significantly. Now let's talk about the other signs and symptoms that appear along with pale stools when there's bile duct obstruction or liver cancer, because recognizing the complete pattern is what will help you differentiate something temporary from something that needs immediate medical attention. First, dark urine. When bile can't leave the liver through its normal pathway, which would be through the bile ducts to the intestines, it starts to leak into the bloodstream. Bilirubin, which should be in the stool, making it brown, is now circulating in the blood at very high levels. The kidneys try to filter this excess bilirubin and eliminate it through urine, which is why the urine becomes that characteristic dark, reddish-brown color, like black tea or Coke. This is a sign that should never be ignored, especially if it comes with pale stools. Second, itchy skin, which we technically call cholestatic pruritus. When bile builds up in the blood, bile salts deposit on the skin and cause intense, persistent itching that worsens at night and doesn't respond to common creams or antihistamines. Patients describe it as an itch that comes from within, that makes you want to tear your skin off, that interferes with sleep, quality of life, and mood. It's a very characteristic symptom of biliary and liver problems. Third, jaundice, which is the yellowing of the skin and the whites of the eyes. This happens when bilirubin levels in the blood get very high. Jaundice usually appears first in the eyes, so if you've noticed the whites of your eyes are a bit yellowish, it's not normal. You need to get it checked. Fourth, pain or discomfort in the upper right quadrant of the abdomen where the liver is located. It can be a dull, constant ache, or it can be a feeling of heaviness, pressure, like something is there that shouldn't be. Fifth, unexplained weight loss. If you're losing weight without dieting or exercising more, it can be a sign of cancer because tumors consume a lot of the body's energy and alter metabolism. Sixth, loss of appetite and nausea. Many patients with liver cancer report that they simply don't feel like eating, that food has no taste, that they feel sick just thinking about food, especially fatty foods. Seventh, extreme fatigue, that tiredness that doesn't improve with rest, that makes you feel exhausted all the time, with no energy for daily activities. And eighth, fluid buildup in the abdomen, which we call sites. This happens in more advanced stages, when the liver can no longer produce enough protein to keep fluid within the blood vessels, and this fluid leaks into the abdominal cavity, causing the belly to swell. If you have fatty liver and are experiencing any of these symptoms, especially a combination of pale stools with dark urine, you need to see a doctor immediately. Don't wait. Don't think it will pass on its own. Don't be afraid of the diagnosis, because the sooner you discover the problem, the greater your chances of successful treatment. And if you have fatty liver but are not yet experiencing any symptoms, that doesn't mean you can relax and ignore it. It means you still have time to reverse the condition, to prevent it from progressing to steatohepatitis, fibrosis, cirrhosis, and cancer. How? Through lifestyle changes, which are the fundamental pillar of treating fatty liver disease. Comment below with your AST and ALT levels if you've had recent tests, because these markers are extremely important for monitoring your liver health, and sharing this information can help others understand their own condition. All right, let's get down to the practical stuff. What you need to do from now on to protect your liver and stop simple fatty liver from turning into something much more serious. First off, and this is non-negotiable, you need to lose weight if you're carrying extra pounds. Weight loss is the most effective treatment for fatty liver, and studies show that shedding just 5 to 10% of your body weight is enough to significantly reduce liver fat. But I'm not talking about crash diets, starving yourself, or chugging miracle shakes. I'm talking about sustainable healthy eating, smart calorie reduction, prioritizing real food, and drastically cutting back on ultra-processed foods, refined sugars, white flour products, fried foods, and saturated fats. Second, you need to incorporate physical activity into your routine. And when I say physical activity, I'm not saying you need to become an elite athlete or spend hours at the gym. I'm talking about a 30-minute brisk walk, a day, 5 times a week at a minimum. It could be a walk in the park, a stroll on the treadmill, dancing in your living room, swimming, or cycling. The key is to keep your body moving consistently. Exercise reduces insulin resistance, a major driver of fatty liver, helps burn stored fat in the liver, improves insulin sensitivity, lowers inflammation, improves your lipid profile, and offers huge cardiovascular benefits. Third, strictly manage your blood sugar levels if you have diabetes or prediabetes. Insulin resistance and type 2 diabetes are closely linked to fatty liver, creating a vicious cycle where one exacerbates the other. Fourth, completely avoid alcohol consumption. Even if you have non-alcoholic fatty liver disease, alcohol is a powerful aggravating factor that speeds up disease progression. Fifth, address other associated metabolic conditions like high blood pressure, high cholesterol, and elevated triglycerides, because all these conditions are part of what's called metabolic syndrome and contribute to liver damage. Sixth, consider supplementation with vitamin E and omega-3s under medical guidance, as there's evidence these supplements can help reduce liver inflammation in some patients. Seventh, get regular medical checkups, including blood tests to monitor liver enzymes like AST, SGOT, ALT, SGPT, GGT, alkaline phosphatase, bilirubin, and imaging tests like an ultrasound or liver elastography to assess the degree of fat and fibrosis in your liver. And eighth, but certainly not least, pay attention to warning signs. Any significant change in symptoms, any appearance of pale stools, dark urine, jaundice, intense itching, or persistent abdominal pain, you need to seek medical attention immediately. Don't wait for your next routine appointment. Go to the emergency room, because time is life when it comes to serious liver disease. Now let's tackle some frequently asked questions I get every day in the office and here in the channel comments. First question, do pale stools always mean cancer? No, absolutely not. Pale stools can have various causes, from temporary poor diet, certain medications, intestinal infections, to gallbladder issues like gallstones. What distinguishes a benign cause from a serious one is the persistence of the symptom and the presence of other associated signs. If your stools were pale for a day or two and returned to normal, it's likely nothing serious. But if they've been pale for more than 3 days, and you also have dark urine, itching, and yellowing of the skin, then yes, you need to get it investigated urgently. Second question, will everyone with fatty liver develop cancer? No, definitely not. Most people with fatty liver disease will never develop cancer. But the risk does exist and is higher than in the general population, especially if fatty liver progresses to steatohepatitis, fibrosis, and cirrhosis. That's why it's so important to treat the condition from the start, make lifestyle changes, and follow up with regular exams, because the more you control the disease, the lower the risk of serious complications. Third question, is fatty liver reversible? Yes, in most cases, yes, especially in the early stages. If you just have simple fatty liver without significant inflammation or fibrosis, it's entirely possible to reverse the condition with weight loss, a proper diet, and exercise. Even in cases of mild to moderate steatohepatitis, many patients can see significant improvement and even reverse the inflammation. However, in cases of advanced fibrosis and cirrhosis, complete reversal is more difficult, but it's still possible to stabilize the disease and prevent progression. Fourth question, what tests do I need to monitor my liver? The basics include blood tests measuring liver enzymes like AST, SGOT, ALT, SGPT, GGT, alkaline phosphatase, total and fractionated bilirubin, albumin, and prothrombin time, as well as tests to assess kidney function, blood glucose, HbA1c, and a complete lipid profile. Imaging tests include abdominal ultrasound, which is the simplest and most accessible for detecting fatty liver, liver elastography, which measures the degree of fibrosis without the need for a biopsy, and in some cases, a CT scan or MRI of the abdomen. If there's suspicion of a tumor, a liver biopsy guided by imaging might be necessary for diagnosis. Fifth question, is there medication to treat fatty liver? Currently, there's no specific approved medication to treat non-alcoholic fatty liver disease, but there are several medications in development and clinical trials showing promising results. For now, treatment is primarily based on lifestyle changes and managing associated conditions like diabetes and dyslipidemia. Sixth question. If I get liver cancer, what's the prognosis? The prognosis depends heavily on the stage at which the cancer is diagnosed. Early-stage liver cancer, when the tumor is small and localized, can be treated with surgical resection, radiofrequency ablation, or even a liver transplant in selected cases with cure rates that can reach 70 to 80%. Advanced liver cancer with metastases or vascular invasion has a more guarded prognosis, but there are still palliative treatment options like systemic chemotherapy, immunotherapy, and molecular targeted therapies that can prolong survival and improve quality of life. That's why I stress so much the importance of early detection. The sooner you find it, the better your chances of a cure. Let me tell you about another patient, Mr. Anthony, 65 years old, who I saw about 6 months ago. Anthony was diagnosed with fatty liver 8 years ago, but unlike Mr. Paul and Mrs. Margaret, he took the diagnosis very seriously from the start. He completely changed his diet, cut out sugar, cut out fried foods, started eating more vegetables, more lean protein, more fiber. He began walking every day, first 15 minutes, then 30. Then an hour. He lost 44 pounds in a year, controlled the diabetes he had developed, normalized his blood pressure, and when he returned for follow-up exams, the ultrasound showed much less fat in his liver enzymes were almost normal, and the elastography showed no significant fibrosis. Anthony reversed the condition, and today he feels better than he did 10 years ago. But the story doesn't end there, because even though he reversed his fatty liver, Anthony continues to have regular checkups every 6 months, because he understood that fatty liver is a chronic condition that requires constant vigilance. And it was precisely during one of these routine exams, an ultrasound he had 6 months ago, that we identified a small liver nodule, only about an inch, which wasn't causing any symptoms at all. We investigated with an MRI and biopsy and discovered it was a hepatic adenoma, which is a benign tumor, not cancer, but if left untreated, it can grow, it can bleed, and in rare cases, it can even develop into cancer. Because we caught it early, we were able to surgically remove the nodule. With minimally invasive surgery, Anthony recovered very well and continues to be monitored with no evidence of recurrence. Anthony's story perfectly illustrates two crucial points. First, that it is indeed possible to reverse fatty liver with determination and consistent lifestyle changes. Second, that even when you do everything right, even after reversing the fat, you still need regular medical follow-up, because sometimes lesions appear that are only detected in imaging tests, and the earlier you detect them, the better the treatment outcome. If you have fatty liver, hit that like button now, because it helps me understand that this content is useful to you and motivates me to keep bringing you important information that can save lives. And share this video with someone you love, with that person in your family who also has fatty liver, but is ignoring the problem, because this information could change their life. Let's summarize the main points we discussed in this video, because I want you to leave here with a clear understanding of what to do. Number 1, pale, whitish, clay-colored stools, especially when accompanied by dark urine, are a warning sign of bile duct obstruction that needs urgent investigation. Number 2, untreated fatty liver can progress to steatohepatitis, fibrosis, cirrhosis, and eventually liver cancer. Number 3, other warning signs include intense itching of the skin, yellowing of the eyes and skin, pain in the upper right quadrant of the abdomen, unexplained weight loss, extreme fatigue, and fluid buildup in the belly. Number 4, the treatment for fatty liver is based on weight loss, a healthy diet, regular exercise, control of diabetes and other metabolic conditions, and rigorous medical follow-up. Number 5, fatty liver is reversible, especially in the early stages, but it requires commitment to permanent lifestyle changes. Number 6, regular checkups are essential to monitor the progression of the disease and detect any complications early. Number 7, the prognosis of liver cancer depends heavily on the stage at which it is diagnosed, hence the importance of paying attention to warning signs and seeking medical help immediately if they appear. And number 8, you are not alone on this journey. There are millions of people worldwide dealing with fatty liver, and with the right information, adequate support, and consistent action, it is possible not only to manage the disease, but to reverse it and live a long, healthy, and fulfilling life. Comment if you've tried to reverse fatty liver and haven't succeeded, because I want to understand what difficulties you're facing so I can create more targeted content that truly helps. Before I wrap up, I want to make a final appeal to you who are watching this video right now. If you've noticed any change in your stool color, if you have fatty liver and are ignoring the problem, if you're putting off that doctor's appointment because you're afraid of what you might find, please, don't wait any longer. Don't be like those patients who arrive at my office in advanced stages of illness, when treatment options are limited and the prognosis is guarded. Be like Mr. Paul, who, despite taking a while, sought help in time to be successfully treated. Be like Mr. Anthony, who took the diagnosis seriously from the start and completely reversed the condition. Your life is worth it, your health matters, and you deserve care, attention, and adequate treatment. If you liked this video, if it helped you in any way, give it a thumbs up, subscribe to the channel, hit the notification bell so you don't miss future videos, and share it with those you love. In the next video, I'll talk about the 5 foods you urgently need to avoid if you have fatty liver, foods that are on your table every day and are silently destroying your liver without you even realizing it. You won't want to miss it. Until then, take care of your health, pay attention to the signals your body is sending, and remember, knowledge is power, but action is life. Take care, and see you in the next video.